doctors consider PPIs to be very safe and effective medications. There have been some concerns raised about long-term use, but overall they're very safe. So there's now a substantial number of patients who've been taking PPIs for a long time, in fact, up to 20 or 30 years in some cases, and really the evidence of long-term harm has been pretty slim. There have been some concerns about increased infections, such as with Clostridium difficile, particularly in elderly patients in nursing homes or in healthcare facilities. And probably some other infectious complications are increased, such as community-acquired pneumonia, maybe infectious gastroenteritis. So an initial course will usually be 4 to 8 weeks, 4 weeks or so for a patient with typical reflux symptoms, and perhaps 8 weeks in someone who has atypical symptoms. After that, the dose needs to be reduced to work out what the minimum dose is that the patient requires for long-term treatment. And there are basically 2 ways in which that can be done. One is to swap the patient to taking the medication as required, and we know that about a third of patients will be fine with that. Some patients will relapse, but patients will also need to be told that there is a period of acid hypersecretion, so it may be that after a month or so things will settle down. Where someone else has potentially started the medication, or maybe it's been started in hospital and the resident has just written it up on the discharge script where it was only intended to be given short term, the patient goes back to the GP says, well, the hospital started it, therefore I should continue it. Or sometimes the patient will come into hospital. We may not know all of the details about why the medication was started, and the consultant or the hospital doctors may not think about, does this patient actually need the medication? What's the indication for it?